Clean intermittent catheterization. Clean intermittent catheterization, also known as CIC in boys and girls. Clean intermittent catheterization is a simple, quick, and effective procedure for the management of children with neuropathic bladder, intractable urinary incontinence, urinary retention, or incomplete bladder emptying. These problems are commonly seen in children with spina bifida, spinal cord injuries, or some urinary tract defects. If the bladder is not properly emptied, infections or other problems can happen. CIC is not hard to do. Your child cannot hurt his bladder if he follows the nurse's directions. With a little practice, almost everyone can learn the technique, even a very young child. Most doctors say it is better to do CIC 4 to 6 times per day, depending on a child's needs. C, clean, as germ-free as possible. I, intermittent, done on a regular schedule many times a day. And catheterization, using a catheter, which is a kind of thin tube to drain urine out of the bladder. CIC ensures complete bladder emptying, thereby preventing infection, preserving renal function, and promoting continence. This in turn increases self-esteem, self-worth, positive body image, and the confidence to enjoy and participate in normal everyday activities. This helps to secure the child's physical, psychological, emotional, and social well-being. This is a picture of a catheter used in CIC. Educational implications for CIC. School staff do not understand bladder problems as well as other long-term conditions such as diabetes, asthma, and epilepsy, and this lack of knowledge and understanding is a major reason for anxiety and concern. The intimate and perceived medical nature of CIC can raise issues about child protection, the risk of harm to the child, and debate about who should be responsible for it. To ensure safety and protection, CIC must be delivered reliably and consistently during the school day by someone familiar and acceptable to the child. Providing CIC in school is fundamental to the overall safety and well-being of the child who requires it. Effective communication, negotiation, and collaboration between health and education services are vital to ensure that it is performed safely and effectively. Privacy and dignity dictates that the number of people present during the procedure should be kept to a minimum, and that must be covered for absences and sicknesses. It is practical for CIC to be undertaken by school staff as they have a common law duty to care and to behave as responsible, careful parent would to promote the welfare, health, and safety of children. Developing a local policy for CIC is essential to decrease anxiety and confusion for parents, school staff, and health professionals, and will ensure commitment and promote shared governance and ownership. There are many roles and responsibilities. I will just name a few. These will be included in my pamphlet. Health professionals involved in the age of children with bladder problems should be appropriately qualified and competent to teach clean intermittent catheterization. Their roles and responsibilities include to provide education and information regarding the individual child and the medical condition and the procedure, negotiating, planning, and delivering evidence-based training, which is child-specific, providing ongoing support for children, parents, and school staff, making sure that they are familiar with local, national policy, and available literature. School staff must be taught effective hand-washing techniques prior to beginning the procedure. This is part of the training. The school administration, teacher, nurse should ensure that staff receive training and that resources are available for such training. While parents may play an important part in the training process, it is not appropriate for parents to be responsible for organizing and delivering training to schools. Your administration, as well as the nurse, teacher, should all be involved in the plan. Individual healthcare plans should be drawn up by the school nurse and person teaching CIC in collaboration with other staff members. Supplies needed: catheters, disposable wipes or washcloth, lubricant, container, syringe. There are 10 steps to do a CIC properly for boys and for girls. These can be found by visiting the website www.healthychildren.org. And here is a picture of a CIC for a male and a CIC for a female. Also in my brochure, I will list several family resources. These have to do with insurance. There are some sites that will give you free catheters. Also, there's a PowerPoint, very informative. A couple of YouTube videos that will go into depth about insertion of a catheter for both male and female, and as well as some other resources for parents. Thank you. Again, this is Pamela Bone, and thank you for watching.